Hello friends. Today we are going to discuss about impact of COVID on mental health of the general population. I am Dr. Suresh Bada, Professor of Psychiatry, working at NMHS, Bangalore. Before I start my presentation, I would like to place this disclaimer. This presentation is for academic and training purpose only. If you want to have a professional opinion, please do contact a psychiatrist or a pulmonologist or an epidemiologist. Conflict of interest? None. The objective of this video is to assess or to estimate the impact of COVID on mental health of the general population. At the same time, what are the solutions to tackle this mental health pandemic? We are going to discuss in this video. This video is targeted for policymakers, health officials, psychiatrists, mental health professionals like psychologists, social worker, psychiatric nurses, and also non-governmental organizations working in the area of mental health, civil societies, and also corporate sectors so that they can take care of their workers and also they can invest in mental health as a CSR funds. Let's discuss about the impact of COVID on mental health. COVID infection not only affects the lung but also the brain. The initial signs and symptoms directly affecting the loss of smell, loss of taste indicated it definitely invades the neuron. And also further, later we came to know about the delirium and also Guillain-Barré syndrome. For a part of time, we realized post-COVID cognitive deficits were also common. Further, the pro-inflammatory cytokines directly affected the brain. Later, thrombogenesis, which can cause stroke, also has become well known. As you know, COVID has direct affinity towards angiotensin converting enzyme 2 receptor. From there, it enters a cell, replicates the RNA, and then the host cells are released. This suppresses the T cell. So that means immunity is lowered. That means the virus can move to any part of the body. Further, it directly impacted on HPA axis. In rodent experiments, it has been found that COVID viruses directly affect the sympathetic activity and decreases the serotonin level. That means it directly causes vulnerability towards stress-related conditions. This is the study which clearly showed that the stress and also COVID viruses directly affecting the pituitary gland. From there, release of cortico-releasing hormone and also ACTH, which further increases the cortisol, and then again the vulnerability of infection increases. It is a cascading effect, and that again directly shows that COVID virus directly affects the brain. And directly we understand it's affecting the neurons, indirectly through cytokines. But at the same time, the patient, that means person with mental illness, if he is taking medications, which also can affect the way the COVID is transmitted. Further, as you know, stress also plays a very essential role in formation of the new psychiatric symptoms. Let's understand the phases of disaster now from the mental health perspective. As you know, the COVID infection is a biological disaster. But let's understand the disaster as a per se. The various phases of disaster. As soon as the disaster strikes, the emotion rises. You can see the first phase is heroic phase. People jump into the disaster zone and try to save each other. And the next phase is honeymoon phase, which starts from 2 weeks and lasts for 2 months. In the honeymoon phase, most of the survivors will be in the relief camp. After 2 months, invariably the long-standing disillusionment phase occurs, which will last for up to 3 years. This is the time mental health morbidity increases. Invariably in physical disaster, the recovery occurs only after 3 years. That we call it as the restoration phase. But now let's understand this from biological disaster perspective, because COVID is a biological disaster. If you look at the biological disaster, WHO classification, it says phase 1, there is no human infection. Phase 2, there is animals to human infection, only 1 or 2 confirmed cases. Phase 3 is sporadic or cluster of human cases. Phase 4 is community level outbreak. That means human to human transmission has started. Phase 5, from one community to another community or else 2 or more countries. The final one is the phase 6, which is 2 or more regions of the WHO has occurred. That means pandemic. That means it has already crossed from one continent to another continent. This is the way the biological disaster moves. But however, after the phase 6, invariably the post-peak period occurs. Invariably it may start a second wave, third wave, fourth wave. So you should be ready for the subsequent waves. But after the post-pandemic period, once you have controlled over the infection, we need to evaluate, acknowledge, share the information, share the skills we have done. We have to focus on rehabilitation, prepare for the next pandemic. Now, we will superimpose the biological disaster on the physical disaster. You can see the phase 1, 2, 3, 4, 5, 6, which is a biological disaster, and the below one is a physical disaster. You can see up to 6 is the pandemic disaster. That is, the pandemic, the infection is moving from one continent to another continent. But look at the disillusionment phase. This is the time when mental health morbidity increases. This is the time when we need to act, we need to identify, we need to treat mental health morbidity. If you know the possible pandemic wave scenarios, it is easy to control the pandemic, easy to predict, and also easy to proactively do certain measures to control the number of infection. Hence, the CIDRAP, that is Center for Infectious Disease and Research Policy, came up with an important publication. They did the prediction of different types of waves, and they came up with 3 different possible pandemic wave scenarios. Scenario number 1, that is peaks and valleys. Here, the number of peaks and valleys will be same. That means infection remains tightly within the community and also moves from one community to another community, and you can see the peaks. Coming to the scenario 2, that is fall peak. Second or third wave will be the largest, and subsequently they will have a smaller waves. That is the second scenario. Third scenario is slow burn. That means second phase will be the biggest and subsequently the waves will be smaller. Depending upon the different type of the scenario, we need to plan. Depending upon the different types of scenario of wave, the mental health morbidity also increases or decreases. That means we need to act proactively. Not only that, the COVID infection, whatever we have done the prediction, it may not directly dependent upon the virus because human behavior is complex. Virus is transmitted from one human being to another human being depending upon the behavior. If the general population is highly responsible, it is easy to control this pandemic. If the population behaves irresponsibly, not doing physical distancing, not wearing mask, not following the COVID protocol, that means it is difficult to control the pandemic. Now, we need to understand one thing. Longer the duration of COVID infection, higher is the mental health morbidity. Let's understand the impact of COVID. If you look at the COVID, directly it affects the pre-existing mentally ill people. We already, before the developing this COVID infection or the pandemic, we had certain number of persons with mental illness. Once the COVID came, that means there are high possibility those people who had already mental illness can relapse. Further, the vulnerable population can have a precipitation of mental illness. For example, in a family, there is already a person with mental illness. That means there is genetic vulnerability in that population. Because of the COVID infection, those families can develop mental illness. Further, there are many people who are on medication. This medication can alter the course of COVID infection. Further, the stress of direct because of COVID infection on the body. Further, the impact of environment on the body. That is because of financial loss, job loss, relationship issues. All these also can affect directly on the mental health. Let's discuss each one of them. But before we move on, we need to understand about the pre-existing mental illness. Let's look into the pre-COVID state, because depending upon the pre-COVID status, how we had responded earlier, and how much we need to proactively act to control the pandemic of mental illness lies here. First, understand the National Mental Health Survey, that is, pre-pandemic. In 2014 and 16, there was a study conducted by Ministry of Health and Family Welfare. This study was executed by NMHS, Bangalore. This was the largest study with regard to mental health survey across the country. This study clearly said that 10% of the population are suffering from mental illness at any given point of time. That means if we have 138 crore population, we have 13.8 crore population suffering from diagnosable mental illness. But however, the severe mental illness is 1 crore, that is 0.8%. This is the mental health morbidity before COVID. Further, out of this, 70 to 86% of them who have been diagnosed to have mental illness were not on treatment. It means treatment gap is huge. The reasons may be many. For example, not availability of treatment, access to mental health care is very poor, non-availability of medications, stigma, discrimination, not aware that they are mentally ill. So there are many reasons regarding the treatment gap. But the point what I am trying to emphasize here is 70 to 85% not on treatment. There was one more study which was conducted in 2019 and released. This is National Survey on Extent and Pattern of Substance Use in India. This study was commissioned by the Ministry of Social Justice and Empowerment, Government of India, and this study was done by All India Institute of Medical Science, New Delhi. This is one of the largest study in the world. It did the survey of 2,111 household survey, 186 districts, 4,73,569 individuals were assessed. And these are the results. Alcohol use. If you look at that, I'm talking about 2.9 crore population are dependent on alcohol. That means 2.9 crore people are addicted to alcohol. That means they require alcohol almost daily. That is addiction, dependence. That means 2.9 crore families are suffering because of alcohol. It is not the individual, the whole family suffers. Moving to cannabis, if you look at the dependence, that is 25 lakh people are dependent on cannabis. That means 25 lakh families are suffering because of cannabis. I'm not talking about users and harmful use. I'm talking about addiction, that is dependence. Moving to opioid. Again, you can see 28 lakh people are dependent or addicted to various one or the other type of opioid. That means 28 lakh families are suffering because of opioid use. Coming to inhalant use, that is solvent abuse. For example, petrol sniffing, glue sniffing. So these are the various inhalant use. Look at the dependence. 8.5 lakh people are dependent or addicted to inhalant use. Unfortunately, majority of them are children and adolescent. That means substance use has not even spared children also. So we need to take care of this 8.5 lakh inhalant users, or we can call it as addicted. Further, if we look at the other drugs, 3.2 lakh cocaine dependence, that is addiction, 7 lakh amphetamine dependence, what we call it as stimulants, and 3.4 lakh hallucinogens dependence. These are all again addicted, or what we call it as dependent pattern users. Further, if you look at the implication of this survey, that means 2.9 crore people are addicted to alcohol or dependent on alcohol. 0.8 crore are using illicit drug dependence. In total, you can say 3.7 crore people are dependent on either alcohol or the other drugs. That means 3.7 crore families are suffering because of substance use. Again, I am emphasizing 3.7 crore families are suffering because of this substance use. Let's understand what is the impact of COVID on children and adolescent population. If you look at the Indian population is one of the youngest population in the world. 40% of our population approximately belongs to child and adolescent category, that is below the age of 18 years. That means it amounts to 48 crore population are children and adolescent. The study done in 2014 by Dr. Savitra Malhotra and Patra clearly said that 6.46% of the children and adolescent in the community are suffering from one or the other mental illness. That means if you look at the prevalence of mental illness, if we have 48 crore children population, we are going to have 3 crore population having one or the other mental illness. That is amounts to 6.4% as per Savitra Malhotra's study. My dear friends, we are talking about 3 crore children and adolescents having diagnosable mental illness. Coming to geriatric population, that means geriatric population are those population who are above the age of 60 years. They are approximately 9%. That means 12 crore population are elderly in our country. And 10% of the geriatric population have psychiatric morbidity. This is as per National Mental Health Survey study. Recently they did the analysis and published it. And most of them are depression and anxiety. If you convert it into numbers, out of 12 crore, 10% are ill means 1.2 crore population are suffering from one or the other mental illness. My dear friends, pre-COVID situation is pretty bad. Approximately 10%, that is 14 crore population are suffering from one or the other mental illness. They need to be catered. Unfortunately, the COVID is going to cause relapse in them, or else their illness becomes difficult to control. So this is the scenario what I am talking about, pre-COVID situation. There is one more important issue which we have not discussed, that is suicide and attempted suicide. India has the largest number of suicide. In 2020, NCRB, that is National Crime Reports Bureau, clearly documented and published a report. In that, it clearly said that a total of 1,39,123 people committed suicide, that is death by suicide. Every day, 381 death by suicide occurs. And if you look at the numbers, every hour, 16 people death by suicide. Approximately for every 225 seconds, one person dies because of suicide. So these are the numbers, my dear friends. And into 20 is the attempted suicide, but they could not complete by committing suicide. That means if you consider 1,39,123 documented suicide into 20 means 27,82,460 people attempted suicide. My dear friends, this is a huge number. We need to cater. We need to help them. We need to provide care. That is mental health care. So if you look at the pre-COVID scenario is pretty bad. Now the impact of COVID is going to accentuate the possible mental health scenario in our country. So what are the impact of COVID and post-COVID scenario with regard to mental health? Obviously, it's going to worsen. If you look at the challenges, the main challenge what I'm going to predict is the non-substance dependence, especially in child and adolescent population. We have approximately 40%, that is 48 crore population of children and adolescent. They are consuming digital substances. That means they are using the internet. There we are going to have a difficult scenario to deal with regard to technology addiction, internet addiction, pornography addiction, gaming online, gambling online. These are the issues we are going to see huge in numbers. Further, because of this technology, we are going to have problem with regard to relationship issues, school dropouts. We are going to have the dissociative spells, depression. So these digital substances can be considered as a gateway for hardcore drug use, possibly in near future. These are the possible estimates, or we can call it as guesstimates, which we are going to predict in near future. Further, especially in the adults, financial loss, job loss or livelihood loss may further increase depression. Domestic violence, sexual abuse in women can increase the depressive episodes, anxiety disorders, post-traumatic stress disorder, relationship issues because of lockdown, staying or working from home can also cause various mental health issues. And further, children and adolescents' lives have come to halt from past 1 year because they are not going to school or colleges. Schools and colleges, they normalize their routine and their mental health morbidity decreases. Since they are at home, there is a high possibility the mental health morbidity may further worsen. Female children drop out from schools and college is highly possible. Death of a family member, unresolved grief. That means because of this pandemic, there was earlier whenever there is a death, the people used to get together, do ceremony, and they used to do the ritual. Unfortunately, this COVID pandemic has stopped that grieving ritual. That means we are going to have grief reaction in the long run. Relapse of pre-existing mental illness, which I discussed, is going to be a major challenge. And also, precipitating of psychiatric illness in a vulnerable population is also another biggest challenge we need to deal. At present, we do not know the long-term impact of COVID on brain. That means, similar to the 100 years back, we had seen influenza pandemic. That is, during 1918. At that time, the rough estimate said that 5 times of the mental health morbidity occurred within 5 years of this influenza pandemic 100 years back. That means, imagine, we have 10% of our population had pre-COVID mental illness. Because of COVID, even if it doubles, we are going to see more than 28 crore population suffering from one or the other mental illness. That means it's a huge population. We need to provide care. This is a rough estimate. We do not know how our population is going to deal with this pandemic. So what are the possible solutions? Let's discuss about that. In this regard, May 31st, 2021, National Human Rights Commission, considering the impact of COVID, especially second wave, they came up with a 2.0 advisory with regard to mental health issues. This advisory plays a very important role across the country and it needs to be implemented at the earliest. What are those advisories? They have come up with clearly 10 points which every state needs to act. Those 10 points are: access to mental health care should be facilitated, dissemination of information with regard to COVID to person with mental illness to be done at the earliest, awareness, grievance redressal and review board should be constituted at the earliest, extending outreach of mental health support, support for special groups, suicide prevention, health insurance for persons with mental illness, media sensitivity with regard to reporting of COVID, and promotion of research. Let's discuss each one of this point. First one is access to mental health care. As you know, pre-COVID, we had 14 crore population which need mental health care. Now, it may increase. Hence, accessibility and affordability of mental health care is very essential. And availability of services should be made available from community health centers and above. That means district hospital, medical colleges, and also tertiary care center. At the same time, availability of inpatient care should be made available in every district hospital so that the patient need not from one pillar to post to get admitted for persons with mental illness for their mental illness care. At the same time, even in the inpatient care, when you are admitting a person with mental illness, you need to do COVID testing and you should facilitate a family member to stay with the person with mental illness so that if he develops COVID, you need to provide care with the help of the family member. As you know, when there is mental illness and he gets infected with COVID, it will be a very difficult scenario to provide care for a person with mental illness. That means a family member support is highly required. So, COVID testing has to be done both for the patient and also family member before admitting into any mental health establishment so that the staff inside are safe and also other patient inside the mental health establishment also need to be taken care. Hence, the COVID testing is mandatory, especially with regard to inpatient care. At the same time, availability of psychotropic medication should be done from the community health center and above. That too with regard to essential psychotropic medication. Government of India on 16th August 2019 came up with the notification the list of medication, both allopathy and Ayurveda medicines, which have been already notified. These medicines should be made available from community health centers and above. At the same time, universal availability of mental health care should be ensured. Further, training of human resources is biggest challenge. We have hardly 9,000 psychiatrists, around 2,000 psychologists, and 2,000 psychiatric social worker, and 2,000 psychiatric nursing. That means with this minimal amount of healthcare personnels, it is very difficult to provide care. Hence, we need to train the large number of people to provide care. At the same time, access to vaccination is very essential, especially with regard to homeless mentally ill. They may not have any ID. They may not have any Aadhaar card. In such a scenario, the Supreme Court has clearly said that facilitate vaccination. And many of the states like Karnataka has already started doing it. With regard to family members, please provide vaccination to them also, because they are at high risk of developing COVID, because a person with mental illness may not be able to understand the severity, the nature of COVID infection. He may not follow the COVID protocol. If he gets infected, the family member, invariably the geriatric population who is providing care for a person with mental illness, may get infected. Hence, family members need to be vaccinated at the earliest. Now the issue comes about refusing to give consent for vaccination, especially with persons with mental illness. There is high possibility. In such a scenario, the person with mental illness capacity should be assessed. And if he does not have capacity, you need to take consent from the family member to vaccinate. If the person has capacity, he will decide whether he will get vaccinated or not. At the same time, the NHRC also said there should be provision of funds to run these mental health establishment and provide mental health care in the community. Coming to the second point, dissemination of information. Awareness of COVID for persons with mental illness and their family members should be done at the high priority. At the same time, 24/7 help desk should be available, and that has been started in NIMHANS, Bangalore. Sharing of health status with regard to caregivers, with regard to the persons with mental illness, has to be done to the caregivers. As you know, there are many mental health establishments where the patients are staying alone. So their health status need to be updated to their family members, and telling them how they are done and what are the precautions are taken in the mental health establishment should be updated. Coming to the third, awareness. So there should be a display of list of authorized mental health professionals should be available in every state. Unfortunately, many of the states have not made this list available. Hence, the population at large do not know where these psychiatrists, clinical psychologists, psychiatric social worker and nursing are providing care. That means that still has to be implemented. At the same time, preventive and curative measures should be implemented, such as yoga, lifestyles. Those things has to be changed, and also life skills to be implemented. At the same time, sensitization of frontline workers with regard to burnout and mental health issues need to be done. Automated messages should be sent to their mobile phone so that how to take care of them, stay away from drugs and alcohol, and also COVID protocol to be followed. Coming to the Grievance Redressal and Review Board. National Human Rights Commission has clearly said that grievance redressal mechanism should be robust. At the same time, Mental Health Review Board, as per Mental Health Care Act, should be started in every state. Unfortunately, on this date when I am doing this video, hardly 2 states have come up with Mental Health Review Board. Many of the states do not have functional Mental Health Review Board. Imagine how we are going to implement Mental Health Care Act across the country. Hence, NHRC has clearly said that please form Mental Health Review Board. Coming to the point 5, extending outreach of mental health support. As you know, the mental health human resources is very less. In this regard, the NHRC clearly said the maximum numbers should be trained with regard to mental health first aid and also psychological first aid. At the same time, the NHRC clearly insisted telepsychiatry and telepsychotherapy services should be made available in every state. Substance abuse prevention and intervention should be done from community health centers and upwards. Unfortunately, many states do not have de-addiction centers at the district level hospital. Counseling for patients recovered from COVID-19 has to be done. Many states are doing wonderful program. With regard to national level, NIMHANS has a helpline. At Assam, Manon Cares are doing a wonderful job. So similarly, some of the states have their own helpline who are doing these counseling services. Coming to the 6, support for special groups. Mental health support for frontline workers is essential because this pandemic is already crossing more than 15 months. That means frontline workers are getting exhausted. That means their burnout is increasing. We need to provide mental health support and stress management. Homeless persons with mental illness may not have any kind of ID. When you want to admit them, when you want to test them for COVID testing, don't ask for ID. If they have ID, excellent. If they don't have ID, just because they don't have ID card, do not refuse to provide vaccination, do not refuse to provide COVID testing and other welfare measures. At the same time, child care institutions like orphanages and various other institutions needs to get mental health support. Coming to suicide prevention, of course, COVID has triggered a pandemic of mental health. The suicide rate may increase. Hence, steps for prevention of suicide to be done at the earliest. At the same time, suicide prevention policy should be implemented. At the same time, presumption of stress, that is, as per Mental Health Care Act of 2017, Section 115 clearly said that whoever attempts suicide shall be presumed to have stress and they will not be booked under Section 309 IPC. This is a wonderful move which was done pre-COVID. Hence, this clause is going to help for help-seeking behavior for a person who is depressed or attempted suicide. Coming to the 8th point, health insurance for persons with mental illness, which was denied since long. The NHRC and also Mental Health Care Act clearly said that health insurance should be given to persons with mental illness. Media sensitivity in reporting about the pandemic and greater attention to the mental health. As you know, recently the way the media has depicted a death of a celebrity with regard to suicide, and the other one is the way they depicted the COVID death and cremation on media. That's unwanted and unwarranted at this point of time. Of course, the media needs to report, but it has to be reported without glamorizing it, without sensitizing it. So, the person who are responsible will get the message without trying to gain more TRP. Hence, we call it as media as the 4th pillar of democracy. Hence, they need to report with high sensitivity and responsibly. At the same time, promoting research with COVID is very essential. My dear friends, the important way to go forward is implementation of Mental Health Care Act of 2017. This was passed on 7th of April 2017 and it received the President assent on that day. This legislation should be implemented with the true spirit so that the mental health care is available at every PHC, at every community health center and the district hospital. The implementation of Mental Health Care Act of 2017 is the only way to go forward. All state governments and union territory should take this Mental Health Care Act seriously and implement it. And this should occur on priority basis. Further, innovative solutions should be taken into consideration because the need to provide care for our general population is huge. Pre-COVID it is 14 crore. Post-COVID it may increase the twice, that may be at around 28 crore. That means we have to come up with innovative solutions such as task shifting, task sharing. We need to train ASHA workers, Anganwadi workers, community health workers, at the same time primary health care center doctors, wellness center doctors, including Ayush, in recognizing persons with mental illness and referring them. And also medicine should be made available in every PHCs and wellness center so that the person with mental illness need not travel all the way to the district or the medical colleges or to a psychiatric institution. Innovative solutions like training of all healthcare professionals is the need of the hour. We need to deprofessionalize mental health care services. As my teacher used to say, the mental health care should not be left alone to the mental health professionals. Mental health care is everyone's business. We need to leverage digital technology to reach the unreached because pre-COVID era we had 14 crore population with mental illness. Post-COVID it may increase twice or thrice. If it is 28 crore, that means the numbers are huge. We need to prepare ourselves now to provide care for persons with mental illness who are going to come in near future. So to conclude, my dear friends, psychiatric illness needs attention at this point of time because the sheer numbers are huge, and in near future the numbers are going to increase because of COVID pandemic. At the same time, the aftermath of the effect of pandemic like lockdown, substance use, and also various other social issues can increase the morbidity of mental health. Hence, innovative solution is the need of the hour, such as task shifting, task sharing, training of ASHA workers, Anganwadi workers, starting first line of treatment at primary healthcare center, involving Ayush, making the medicines available at PHC and wellness center is a mandatory step which needs to be implemented at the earliest. At this point of time, we do not know the long-term impact of COVID on our brain. We need to prepare ourselves. The only way to deal with the biological disaster is to prepare ourselves. At this point of time, we need to prepare for the mental health pandemic. And please remember, there is no health without mental health. Thank you for giving your valuable time. Stay safe.